Infants and toddlers, typical growth and development. The importance of caregivers in early development. Infants thrive when they receive responsive and consistent attention from caregivers. Once trust is established, infants feel confident enough to begin exploring their surroundings. The main way that children learn about the world is through play and their own exploration. A child who does not feel confident or safe in their environment or with their caregiver may develop slowly, both mentally and physically, and have long-lasting impacts. Parents who better understand behaviors during infancy and toddlerhood find it easier to cope with different situations by offering more guidance. Infant growth. The average birth height for infants is 18 to 21 inches with an average weight of 7 to 9 pounds. Average birth weights and heights can vary based on race and ethnicity, as well as what part of the world a child was born in. For example, a child born into a Western culture, such as America, may have a higher birth weight than a child who was born in a third world country due to different resources and nutritional values. By the time a child reaches the age of 1, their birth height should have increased by 1.5 times and their weight by 3.5 times. They should also have 4 upper and 4 lower teeth that have erupted. An infant's head will appear larger in proportion to their body and have fontanelles over the course of the first year of their life. These are soft spots in the bony skull that are covered by a tissue membrane. This should close up after the first year of life. Most children will have skin that appears lighter in color at birth that will darken over time. It is common with some Asian, African American, Native American, and Hispanic children to have Mongolian spots, which are bluish-grayish bruises that appear over the skin that will disappear by the time a child reaches the age of 6 or 7. It is rare that these spots will continue to appear past this age. Toddler growth. A toddler's growth rate will slow considerably during this stage of life in comparison to growth as an infant. On average, toddlers will gain 4 to 6 pounds in the year after they turn 1 and grow 2 to 3 inches in height. As a 2-year-old, the growth rate will slow again to gain only 2 to 3 pounds and they will grow 3 to 5 inches in height by the time they turn 3. As they grow, toddlers will appear more adult-like and seem to lose their baby fat. This is a result of the thinning out of the body. Previous developmental years as an infant and as a 1-year-old resulted in high weight gain that evened out as a child reaches the age of 2, when growth rate in height becomes more substantial than weight gain. Their heads will continue to appear large in proportion to the rest of their body, though, as the brain grows to reach approximately 80% of its estimated adult size. By the time a toddler reaches the age of 2, they will have 16 baby teeth, and 4 additional baby teeth will appear by their 3rd birthday. These primary teeth result in a transition from infancy and eating softer foods to eating larger sizes of food with their primary teeth.